You are watching the Doc Talk Show. In the doctor's room.
So we are taking you through a live demonstration of what will happen in a rehabilitation office. This is not your typical doctor's room. This is the treatment room for the fitness and rehabilitation experts. Mr. Sinha is going to tell us exactly how he employs non-pharmacological methods to relieve symptoms such as pain, in particular back pain. We're also going to have a live demonstration of a patient who has been on medications for a long time and hasn't had relief of symptoms. He will come to Mr. Sinha's office and they will use non-pharmacologic techniques to relieve the pain. So, Mr. Sinha, please describe to us this setting.
Yeah. This is where I do most of the treatment. Okay, the treatment can be done seated, lying down, either front or back, or to the side as well.
Okay.
So we've got wax here.
What is that?
Wax.
Wax.
So this is how it looks like, so you can see.
Okay.
So it's a tissue, and then we've got oil. So this oil design, especially, it's got essential oils in there to soften out the skin. So it just goes into the skin to loosen up the skin. Then we've got joint relief cream that you can apply on the joints to loosen them up or relieve the pain. So we've also got a heat balm. Heat balm just basically heats up the muscle. So you put it on there, you leave it for a couple of minutes, it hots the area gets very hot, then eventually cools off. So once it cools off, it relieves that.
It relieves the tension and the,
And also we got to remember about the rice?
The rice, that is rest, ice, compression and elevation.
So this is the ice. This is the deep freeze.
The deep freeze.
Yeah. You can have a feel. So
it's very cold, yes.
Okay. Again, this one, another one you can use on the ankle to protect. So
Mr. Sinha is going to demonstrate to us how they help relieve pain using non-pharmacologic methods, using their variety of products which are displayed right here, and the techniques they employ.
You are watching the Doc Talk Show.
If you can see, doctor, if I see from here, you can see there's a lot going on. Okay, so you can even start from the shoulders. You can see his shoulders rounded.
Okay.
Where should it be? It should be this way. Okay, so if you go back on the back, these muscles are exposed. Okay, so we work our way on the chest area. You can see the shoulders are rotating forward. Okay, so if you can turn around this way, doctor, so you can see the back.
Okay.
Do you see what we see at the back? Okay, the back is rounded. So these muscles are overstretched. Okay, so if you turn back again, okay, so you can see from here the midsection. Okay, so we go down, you can see the midsection is not working.
In what way?
It's not engaging. Okay, it's because these are front muscle opposite to the back. If this is not working, which means the back is being overworking.
So how should the front muscles
if you look at so the front muscle should be levered backwards. They should be engaging. So in this case, gravity is pulling him towards that way. Okay, so you got the hips tight, you got the back trying to hold him in this position. So if you look from here and you look at the hip on this side, again you can see this area not working, the tightness. So you can see again there's tightness in the stomach. This is why I'm saying to you that exercise is very important. So once we relieve this, exercise comes in, so we start building these areas.
Okay.
In terms of the assessment, because my client is experienced back pain, so we do some testing to find out what causes the pain. Okay. So I'm going to ask my client to bend the knee and bring the knee towards the chest. Okay. Any pain? Discomfort? Okay. So if you can raise your leg up. Any pain? So you feel pain. So we realize this is a positive, so there's pain there. If you bend your knee, I'm going to drive it further. Do you feel pain? Okay, so we know definitely it's coming from the hamstring, because when I go that way, it feels. So we know definitely, you can even see the hamstring pulling. Okay. So if you can do a straight leg, you feel pain? Okay. Again, this is showing that my client or my patient has got tight hamstring and also tight glutes, which is the bum muscle, and also the lower back.
Okay.
Okay.
So you said that softens the muscles.
Yeah, it hits up the back.
Mm.
So you just apply it. So throughout, as I'm working with my patient, I communicate. So I try to find out what's going on.
Mm-hmm.
So we work together. We're a team. Because these are tight.
Okay.
Painful? So as I do the treatment, the reason why I'm saying this is different from massage. So these hamstrings, if you look, so you can see all these a connection going that
The
way.
leg muscles.
Yeah, the leg muscles. Then insert into here, then here.
Okay.
So you can see even from here, doctor, if you can see the back, so you can see this side is shifted. You can see compared to that one.
So you're basically looking out for malalignment of the muscles,
That's
the muscle groups appear, if they're equal, if they're not equal.
Yeah.
Okay. So that is what you call the sports
therapy.
Sports massage therapy.
Sports therapy. So this one, so you can see I can apply more pressure. If I apply more pressure, there you go.
I think so what does that mean when you lift the leg?
It's pain. So here, I'm applying more pressure. So I'm realigning these fibers. So it's more painful.
It's more painful.
But different people got different pain threshold.
Okay.
So his threshold, so you can see when I press, it lifts. There you go. The more pain you can take, the more quicker we can release these muscles. So my job, if it's like this,
is to make them straight.
Yeah. Then use exercise to build.
All right.
Okay. So the reason why it's different, so you get the leg, so you can see. Because of this chain goes on, so you're gonna find he's got a muscle here, a piriformis. That comes from here, it runs into the lower back. Okay. So this one is very common with people that put their wallet in the pocket. Do you put your wallet in your pocket? There you go. So what I can do, so I'll show you. So this nerve, there.
That is to loosen up the nerve.
You can see. It's painful.
Okay.
So this nerve aligns here. So it's causing the pain for me. So we've established the hamstring, the piriformis. So you can see if I apply.
Okay.
Okay. So we established it's got piriformis, it's got multifidus, which is the rotation muscles here. So you got two sets. So you got one here.
Okay.
And a pair. So these are used for sports when you're tanning. So when you're playing sport. But as you know, we don't play sport anymore. Very few people play tanning sports. However, you got another one here, another set. This is the one I will use the most when you're driving. So you know when you look on your side mirrors, you're using these ones. Okay, these ones seem to be. But here, so you can see, this is pain. So you have to remember, these muscles are layers. So I'm only working on the top, superficial.
Okay.
Then I have to work on the underneath, then the deeper layers. So each layer that heals, come back and then I work on it.
Okay.
That's why I'm saying that it takes about 5 to 10 sessions to enable to get them. Out of 10, what would you say the pain level is? Out of 10, what would you say the pain level?
7.
There you go.
A lot of pain.
So 7, yes. But 7 is okay. If it becomes 10, then you can reduce it. But also, when I've got a client, I find out the pain threshold. Some people are not very good with pain. So you have to work.
So you work with getting the pain less?
Yeah. So you work with what pain threshold they can do. So some people, so you can see his pain threshold is 7.
So you don't go beyond 7?
Yeah.
Okay.
So I can only work with 7.
Okay.
But then some people are 9, 10. Some people are 2. So you have to work with what they got. But however, my job is to explain. If your pain threshold is 2, it's going to take you longer to heal. So you can see this one. Again, techniques you can use. You can use your palm, you can use your fingers. So you can see. I can use.
Okay.
So you can see that one.
So you work until you only massage until the pain reaches, then you stop.
Yeah. So you work according to what they can handle.
What do we test?
We test the leg. Remember, it
The
was,
leg,
yeah.
okay. Because
So,
you
yeah, because there was pain.
the hamstrings relax, okay.
So does that feel?
Feels
Okay.
better, eh?
But this is what we did the most, so you can see. How does it feel? So you can see. So
Okay.
that's how we test.
What is the take-home message now for people?
What I would say the take home is people have to look after the body. So if you get the first signs like you got pain, go see a specialist. Again, it's very hard to find a specialist here, but I look around. So I deal with these sorts of things all the time, the pain, and people say, oh, we don't know where you are. Or how can we find you? Some people have had pain for years. You know? There's the ones that I've worked on 5 to 10 sessions, they're gone.
Okay.
So it's very important to not ignore this. If you ignore the pain, the early start, the chances are it's going to get worse. Okay? I don't mean to scare you. The worst scenario will be operation. Okay? Whereas this can be avoided. The sooner you respond to it, the better. And it will save you money.
Okay.
Because you all know that operations are not cheap.
So the take-home message is don't ignore the pains in your body. If you're having back pains or muscle pains, whatever kind of pain, make sure you seek the appropriate help and treatment. And remember, there are some methods which do not require the use of drugs, such as the massages, in this case using sports massage, or rehabilitation exercises that can improve your patient's pain and improve their well-being. Always send your comments, your feedback, or your questions on our social media platforms, Facebook, Twitter, and our experts will diligently answer the questions and respond to your messages.